if someone's like, I identify as non-binary and I want to be on fill in the blank hormone, I guess I just don't see that as a problem. I guess with non-binary people, I think it's an empirical question as to whether or not non-binary people think about gender and their own gender more than any other gendered being, right? But what I guess I do kind of see the role and responsibility of trans medical providers as offering hormones in as safe of a manner as possible and leaving it up to the individual. Like, I guess I want to place the expertise over gender lies with each individual and not a medical provider and not a lawyer and not like any other institution. Like, we are the experts over our gender and our bodies. So if someone's like, I identify as non-binary and I want to be on fill in the blank hormone, I guess I just don't see that as a problem.
Okay.
Yeah.
I personally think of certain problems like if someone was, again, I brought this up, but if you're taking estrogen as a man, you're going to grow certain types of anomalous features, right? That will hopefully reflect with your gender identification,
Mm-hmm.
like boobs. And, like if you want to take electrolysis, there's going to be certain types of changes, removing a body hair, whatever the changes are, some of them are permanent. Some of them are going to be permanent. So especially when you start a young child, that's a big debate of the day, right? With certain senators like Rand Paul and
Yeah.
the health committee that Biden has set up.
Mm-hmm.
There's individuals, the trans doctor on that board is advocating for children to have access to those cares. But while in the UK, they're banning puberty blockers for those who are under or below 16, right? 16 below. So
Yeah.
there's certain types of bodily changes that can't be reversed or can't be made up, right? You miss puberty, you miss puberty. And
I mean, but if you put someone on puberty blockers and then once you take them off, they'll go through
20.
Yeah, I mean, I know it's a little different. It's like different
Right.
developmentally. I guess like I don't
They
know.
won't have like, I think my point was if you take away the opportunity to grow a full-fledged penis, they won't have enough sexual tissue right down there to actually create into a vagina a lot of the times, or like the depth of the vagina is going to be pretty small or low unless if you had adult genitalia, right? Unless if you had full developed genitalia. So there's all these different types of, I think, consequences. Again, like I talked about fertility as a big issue. Children especially can't make those certain types of decisions. They're children, they can't consent. That's the main argument coming from various sides. Even LGBTQ advocates too are saying like, children, we need to have them think through these things and we need to help think through these things. So obviously
Yeah.
when you say that we're the experts of our bodies, like you're not trying to say like children need to just make rash decisions about their bodies and their development, right?
Yeah. So I guess most of the time when I think about trans and non-binary stuff, like I am thinking about
About
adults.
adults.
And I do think it does it becomes more complicated with trans youth.
It does. It really does. Yeah.
Yeah. I guess like, one of the things I was concerned about, um, and we talked about this early, I think before we were recording, but
Yeah.
like I think it's a pretty bold statement in the book that we don't have enough evidence in trans medicine. And what I was worried about, and I spoke with my editor about this before the book went out, was like, I am very concerned that someone is going to use that same argument to advocate for shutting down trans medicine. And that's happening right now, right? Like, that is what is playing out in these state legislators. Is if you look at the argumentation that state legislators are offering, it's that trans medicine has no evidence, it's so experimental, therefore we're going to prohibit doctors from doing this. And it is in the name of like protecting the kids. I guess though, like, there might not be a lot of long-term evidence about the effects of hormones and stuff like that. But I do think that the evidence that comes out of the psychological scholarship is pretty clear. And that's, you know, preventing, and again, I'm just thinking about adults,
Mm-hmm.
preventing people who identify as trans in whatever way they identify as trans, preventing them and prohibiting them from accessing gender affirming care has far more psychological harm than any potential like physical health risks that might manifest.
Yeah, like
And
suicide or self-harm.
yeah, yeah, yeah. So,
So we're trying to balance the immediate effects of alleviating gender dysphoria, right? We're talking about trans and non-binary people, binary trans
mhm,
people, non-binary, and then also the long-term effects. What happens if they live only to 50 because they start developing a certain type of ovarian cancer or even breast cancer, in men? So what those issues imply is there's this constant tug and pull, and I think this is going to play out in the next few years still, and we're still having to answer these questions. Like your book is stating,
mhm,
it's not prescribing any certain model. It looks like, which I'm still very curious. I want to ask you about that, but
mhm.
it is stating the fact that there is a lack of clinical evidence about hormone therapy, the long-term effects of that, and the trials of experimental and controls on women taking testosterone, right? As you brought up, like what happens if we have 50 women who take testosterone and 50 who don't take testosterone, and 50 people who maybe are on a placebo, right? So like uh, something to that effect, where you're trying to control and then you're trying to experiment. What are the effects of testosterone taking? And
Mhm.
we just don't have enough robust examples of that, or hardly any, do you say?
Yeah, I mean, I don't think that clinical trial like they don't they don't exist, but they also don't really make sense, right?
They don't make
So
sense. Okay.
yeah, like I don't think you can do a randomized control trial because
Right, the
like
ethics
what
of it.
like what would you do, right? Like
Right, just tell a woman, hey, take this testosterone because we told you to.
yeah, yeah. So, but I think that but that doesn't mean that there can't be like, pooling of data across health databases to look at, I mean, because trans medicine has been going on for so long, you
Right.
can look at the consequences and the risks. But the problem is like most health databases up until recently were not tracking if people are trans. So
Mm.
I think that's one thing, like in our electronic health record. But then, like some trans people are really concerned about that because then it becomes a privacy issue, right? So I don't know, like it's so hard, but
Right.
I think there's enough trans people who would volunteer to share their health information for a 20-30 year period to see like what are the long-term effects of hormones.
There are a couple of Sweden studies that have shown, the tough thing about these long-term studies is that some people, like intersex populations that Alice Drager, whom you brought up, won't follow up because of the surgical hormonal ramifications, um, their treatment.
Mhm,
So maybe they just fell off the map because they moved to another country, or there's also the shame aspect of maybe it didn't work for me. This is one of those discussion points that Lisa Littman and Ken Zucker and others have like warned about, or wouldn't say like, yeah, they would warn about this. Like, we don't know like the full measure of people who are dropping out from these studies, and the studies from Sweden and these Dutch studies that have shown poor outcomes. Not all of them are poor, but
mhm,
these are ones that are the longest term, not just 10-year studies. 10 years is long term, but these are like 50 years from the 70s we're talking about here, right? People who have transitioned since the 70s in Sweden, one of those most liberal and accommodating trans countries, right? There is. And so they've seen that people are still suicidal. There have been lives that have been lost to suicide as well, and
mhm,
these other negative effects. Now, I can't say definitively, is it because of transitioning? I think that there are other reasons, right? Are those mental health illnesses, comorbidities like depression, anxiety, suicide, are they being met through transitioning? And an argument could be we need to help them transition sexually and then provide that extra care, right? Psychologically, so that they
Mhm.
can get on with their lives? Or is it like what Paul McHugh says and what Ryan T. Anderson says, right? They're both conservative. I don't know how they vote, or, I know Ryan T. Anderson, he's Catholic, but they're talking about how people like Walter uh, Meyer or Meyer, and he's talking about how these individuals like Walter and TWT in their book are experiencing such trauma and hurt, and they've had it since a very young age, but going through transitioning only either exasperated it at a certain point. Like at first, it alleviated it, and
Mhm.
then it exasperated it at some point. So now, long-term studies, the point being is they need to be done, and you brought this up multiple times, right? In page 136, you talked about you have to really contextualize this as weird medicine. We're using non-FDA approved drugs in some instances in non-FDA approved ways. So when you say that, like obviously there are certain types of bureaucracies and certain gatekeepers that we need in the medical establishment. That's why I feel a bit antsy when you say that we should allow the patient to make those decisions because, well, patients don't practice medicine. They don't know all the long-term um, effects of medicine, or scientists. If they're not scientists or medical practitioners, those people should be educated on the effects of hormones and surgical interventions as well as therapy. So I think that's why there is such gatekeeping, right?
Hmm.